one, the diagnosis is lupus. To make a diagnosis of lupus, I want you to first think of it in low power. This slide is really good because it seems it had every feature for lupus. The first thing in low power is that we see tons of this thickening of the stratum corneum, especially in the follicle. We call this follicular plugging. For me, just 4 limited differential diagnoses when you see this follicular plugging. First one is lupus. The other one is lichen sclerosus, like the one I showed everyone before, but that one I could not find follicular plugging. And then the third one is PRP. You don't need to know about it because this is just out of the board examination. The last one is scurvy. Scurvy is the patient do not have enough vitamin C. That is scurvy. But I think in the board, I'm not sure whether they will text you for that because right now it's really rare to see scurvy, vitamin C deficiency. So when you see this follicular plugging, I think you just need to think about lupus or lichen sclerosus. And then also focus on low power because most of the dermatitis in them have just pattern recognition. We can see superficial and deep perivascular infiltration. This infiltration should be perivascular or maybe periannexal. Periannexal, that means this lymphocyte just hugging hair follicle or maybe eccrine gland or maybe vessel. So for this low power, you can always thinking really highly suspicious for lupus. And then I think when you try to make the definitive diagnosis for lupus, you always need to go to high power because other feature you also would like to see. But lupus is really tricky. But I think for this one, should be easy. The internet may be slow. Yes. We also can see a little bit vacuolar changes for lupus and also dying keratinocyte. So just like what you see in erythema, multiforme, fixed drop, eruption. So you can see vacuolar changes, intervein changes, dying keratinocytes, and then lymphocyte infiltration. And then sometimes you can also see some pigment dropout because lupus can happen really chronic. It won't happen really acute. So you may also see pigment dropout. But usually you won't see eosinophil. So if you see eosinophil, you need to think a second time whether this is lupus or not. So just really quick recap: follicular plugging, superficial and deep lymphocytic infiltrates, perivascular, perifollicle, perieccrine gland. Then high power, you can see this vacuolar intervein changes. This is the lupus. Usually, you also want to see some mucin deposition, but usually it is really difficult to see. But if you see some bluish, a cellular material deposition, that is also really good for lupus.